All right, there have been a couple of stories here, and I hate to say it this way. This is not the first time we're doing this story, and I understand some of it probably has to do with seasonality. But the situation in ERs is, again, or maybe I should say it's still, a reason for concern. We wanted to talk about this and a couple of other things with Dr. Mitch Shulman. He, of course, an associate professor in the Department of Emergency Medicine at the McGill Medical School, as well as an attending physician in the ER at the MUHC, and is on the line right now. Mitch, let me start by wishing you a Happy New Year.
To you as well and to everyone listening. Only the best for 2025, a better year, okay?
Yeah. Fingers crossed. So let's talk about the situation. I know this is something that's been, a thorn for you for a long time, but it doesn't seem to be getting any better, and that's the situation in ERs right now.
No, and it's expected at this time of the year. People will do everything they can to stay at home up until Christmas, and then starting in Boxing Day, all the things that have accumulated basically just inundate the emergency rooms. And then you have added to that the fact that people were at parties, at get-togethers, they've been exposed to all these different viruses, and then the kids come back from school. Come back to school from their vacation. And so 2 weeks later we get so you get this every January, February. It's expected. It's unfortunate, but it's expected. And there's basically, it's silly in a certain sense only because it's going to happen. It's a shame that we just can't do more to keep it from happening in the first place.
Okay, with respect to, and again, it's funny because I feel like we beat the drum on this so often saying the same things, but maybe they have to be said again. I realize the situation with people not having access to a primary care physician is still an issue, obviously, but it turns out a lot of the people who end up in eMERGE probably don't necessarily need to be there, right?
Exactly. Look, if you have a cold, you have a cold. Man cold or not. I'm not judging, okay? As long as you can keep up with your liquids, as long as you don't have serious underlying diseases, as long as you aren't immunocompromised, you're not very young, most people, even if they feel miserable, can handle this at home. When you want to be concerned is, one, if you're under the age of 2, you want to be in touch with a healthcare professional because little kids don't have a lot of reserve and can get very sick very quickly. You want to make sure what's going on. And of any age, if your immune system is compromised, so let's say you're taking medication that affects your immune system because you have rheumatoid arthritis or ulcerative colitis or any one of a number of diseases, or you're undergoing chemo or radiation therapy, or you have significant poorly controlled diabetes or high blood pressure or kidney disease, you're a dialysis patient, a transplant patient. Those are all the people who, if they're not feeling well and they don't feel they can control what's going on, even if it is a cold, need to be seen by a healthcare professional, not necessarily me in the eMERGE, but a healthcare professional. And for the rest of us, look, rest, plenty of fluids, acetaminophen, which goes by many trade names, and ibuprofen, which goes by an equally large number of trade names, for the aches and the pains and the fever. You gargle with salt water or mouthwash for the sore throat. You take a decongestant if you're congested, and you wait it out. And basically, it'll take 5 to 7 days to get better, and you look for indications that something is going wrong. So if someone's confused or lethargic, or if they're short of breath, or if their fever's persisting and not going away, or if they develop new symptoms, new chest pain or shortness of breath that they didn't have at the start, these are all indications that, yep, it's time to be seen by a healthcare professional, if necessary, in the emergency room. But for the rest of you, I have no magic for a cold. I have no magic tricks up my sleeve for the flu, or RSV, or COVID, except to say, gee, I wish you'd all gotten vaccinated against the flu and against COVID.
With respect to the flu, which you just brought up, and we go through this every year as well, are we seeing a worse cases of flu this year? Is this, again, something that has to be on the radar?
It's the same. Okay. I haven't seen anything yet that makes me think that the season is any worse. The interesting thing is we're seeing both RSV, respiratory syncytial virus, and flu at about the same time. But we've seen that in the past before. Look, if you're going to hang out in parties, if you're not going to wash your hands very often, if you're not going to mask, if you're not going to isolate when you're sick, things are going to spread. And so we just have to learn to cope and to deal with this.
All right, let me move on to the things I mentioned off the top as well. We've been told there's a measles situation. I know I think we had a worse outbreak last year, but it's not gone away. This is still a concern.
Oh, a definite concern. And it's not that it didn't go away. Guess what? It's back again. Someone brought it into the province who was not vaccinated. Most of the cases that we're seeing in people who are either not vaccinated or not properly vaccinated. And you have to understand, measles is wickedly contagious, one of the most contagious viruses in the entire known universe. And what basically happens is the virus lingers in the air because it's spread by coughing and sneezing. And it can last for an hour or two after someone has left, which is why if I think someone's coming to a doctor's office with measles, we tell them to come at the end of the day so there's less chance of them infecting other people. But certainly it usually develops after an incubation period of about 10 to 12 days. And you get sick for 7 to 10 days. And you're miserable. Fever, cough, runny nose, inflamed eyes. The dangers, of course, the complications, which can be ear infections, pneumonia, and people can get severely sick. And you can, under rare circumstances, actually get inflammation of the brain and seizures. So it's not a disease to be taken lightly. And what's really a shame is this disease was almost eradicated. When our vaccination rates were up back in the 80s and the 90s, the disease just didn't exist. And the only reason it's still around is because people have not been vaccinated, have not kept up with their vaccinations. It's pure, it's simple. We could eliminate this disease tomorrow if everyone got vaccinated properly.
Yeah, I was going to say, I thought we already had, to your point. I'm just curious, if you don't mind, from your perspective as someone who's dealing with patients on a daily basis, are you still running into vaccination hesitancy?
Yep. Look, we shot ourselves in the foot. We did a very bad job of communicating and making people understand what was going on with COVID. And we gave an opportunity for people to spew and spread disinformation, which discredited science, discredited medicine, and discredited vaccines and other forms of therapy. And so people lost faith in us and lost confidence in us. It's our own fault. To be totally honest with you, I think if we'd done a better job of communicating and making things easy for people to understand, I don't think we'd be in the situation we're in right now, but things have only gotten worse. Look who's going to be in charge of health in the States, and I leave it at that. That's just, if you ever needed an example of our failure, there it is, staring us in the face.
Before we run out of time, Mitch, let me bring up a couple of things. We talked about measles. I read the other day, and I'm not sure this is necessarily happening here or we have to be concerned about it, but maybe we do because everything is global these days. There has been a death from avian flu in the U.S. Where are we on this?
Oh, don't worry about it. Avian flu so far has not shown the ability to transmit or go from person to person. In all cases that we've been able to identify so far, especially in this case, it was prolonged exposure to infected birds. The disease is out there. Birds are spreading it amongst themselves and amongst their friends. There's a huge outbreak out in BC. There was a kid out there who was very sick but has recovered. But until we see, knock on wood, person-to-person transmission, it's something to be aware of from a public health point of view, but nothing that you need to be concerned about. Okay. The same precautions that protect you against colds and the flu will protect you against avian flu. Just don't hang out with birds.
Yeah, there's a good tip. Just don't hang out with birds, or perhaps with people who have hung out with birds. Last thing I will bring up, I lied. There was one last thing. I know we don't talk about it, and I wonder if that's because we don't want to hear any more about it, but COVID is not gone. There are still, nope. I read today in parts of the U.S., it's actually getting very bad again, and they're trying to impose mask mandates in some spots. What's the situation here?
Definitely around, definitely in the background, definitely popping up from time to time, mostly in people with underlying health issues. The people that we tend to be seeing appropriately are the ones who have underlying diseases like diabetes or something like that, and they're sick. And as we're working them up for any upper respiratory tract infection, we figure out that they have COVID. We are also seeing it in some younger people who shouldn't have been in the emergency room in the first place with your typical symptoms of cold-like symptoms, sore throat, runny nose, runny eyes, cough, sneeze, the usual stuff.
Okay. Last for the third last question. You mentioned when it comes to cold, flu, whatever, the old remedies are still, they're the ones we pass on. They're the ones that still work. Someone's asking, what's the difference between ibuprofen and acetaminophen if you're going to take one or the other?
So acetaminophen goes by the trade names of Tylenol and Atasol, and it's a pain reliever. Ibuprofen, which goes under the trade names of Motrin and Advil, is an anti-inflammatory. So it relieves pain through a completely different mechanism. And there are people who just can't tolerate anti-inflammatories. They have stomach upset, they may have an allergy, they may have peptic ulcer disease, and they've been told to avoid aspirin and anti-inflammatories like Motrin, Advil. Aleve is naproxen, another anti-inflammatory. It's usually safe for most people to take acetaminophen because it doesn't have that anti-inflammatory effect, less likely to irritate the tummy. The key concern with acetaminophen is in high doses for too long, it can damage the liver. And that's why you'll see the recommendations on the label about how much you should take and for how long you should use it.
Got it. Dr. Mitch, as always, appreciate your time. Wish you all the best. Thanks so much.
You too. An absolute pleasure. Have a great day.
You bet. Dr. Mitch Shulman, he's on, of course, weekday mornings with Andrew Carter at about 7:50.